Welcome. This video contains vital information about the pediatric HIB vaccine. It was developed for healthcare providers working at Indian Health Service, tribally run, and urban Indian healthcare facilities. My name is Dr. Jasmine Curry Thomas. I am a member of the Navajo Nation and a resident in family medicine. I am partnering with Native Boost to bring this presentation to you today. For those of you who may not be aware, Native Boost is a project at the Northwest Portland Area Indian Health Board dedicated to sharing accurate, high-quality childhood vaccination resources with Native people and their medical providers. To access Native Boost patient education tools, you can visit www.nativehealthresources.com, click on the Resources tab, and filter resources by the Native Boost campaign. Okay, let's get started. Today we will discuss essential information about HIV infection, HIV vaccines, and current HIV vaccination recommendations for infants. I will also share useful talking points you can use when speaking with parents and caregivers. Finally, I will offer additional resources. Haemophilus influenzae, or HIV, is a bacteria that causes severe disease such as meningitis, other head and neck infections, and pneumonia. Haemophilus influenzae is a bacteria capable of asymptomatic colonization of the nasopharynx. Types A through F are classified by the presence of specific polysaccharides located in the surrounding capsule. Most serious illness is caused by Haemophilus influenzae type B or HIB. Notably, non-typable strains are either non-encapsulated or do not express any of the recognized polysaccharides. These and the other typable strains can also cause disease, but are generally less virulent and less common. HIB, for reasons not clearly known, can cause severe invasive HIB infections, including meningitis, pneumonia, epiglottitis, bloodstream infections, and other infections. Prior to vaccination, HIB was a leading cause of meningitis and invasive bacteremia in children under 5. At that time, the peak incidence of HIB disease was 6 to 11 months of age, corresponding to the time when passive maternal antibodies faded and potential risk of exposure such as daycare attendance or sibling interaction increased. Prior to routine vaccination, most children acquired immunity by age 5 or 6 years old. Risk factors for invasive infection include exposure risks such as overcrowding, daycare or school-age sibling, and low SES. Host factors also play a role, including young age, especially less than 5, chronic disease causing immune compromise, and American Indian Alaska Native race. For AIAN infants, disease peaks at younger ages and may be related to a higher prevalence of exposure factors. Transmission is by respiratory droplets or, in neonates, exposure to amniotic fluid or vaginal secretions during birth. Communicability is generally limited, and secondary causes are rare except in household settings with siblings and less commonly in daycare settings. Humans are the only reservoir host. This figure shows that despite the use of HIV conjugate vaccines, American Indian and Alaska Natives have had a higher incidence of invasive HIV disease compared to other races. The trend had changed by 2017 because of both decreases in incidence for American Indian and Alaska Native children and unfortunately increases in other races. Furthermore, no new publications have reported invasive HIV incidence by race since 2021. As mentioned, HIB, especially in infants, can cause severe infections, including meningitis. Meningitis is an infection of the membrane covering the brain, which can lead to permanent deafness and other neurological impairments in 15 to 30% of those who survive. The fatality ratio from HIB meningitis is 3 to 6%, despite antibiotic treatment. Bacteremia may also result from HIB infection and occurs in 30 to 50% of all infections. Bacteremia can cause pneumonia, septic arthritis, and other serious complications when the bacteria invades the bloodstream and affects various organs in the body. Treatment of each of these infections requires hospitalization, IV antibiotics, and often intensive care. Epiglottitis is an infection and swelling of the structure that covers the larynx or airway and protects it during swallowing. Without appropriate treatment, epiglottitis can cause airway obstruction, leading to asphyxiation and death. With vaccination, HIB epiglottitis has become extremely rare, with more cases recently reported in older adults who were not able to be vaccinated in childhood. Next, we will discuss the HIB vaccine. Today, there are 3 monovalent HIB vaccines and 2 combination vaccines that contain HIB. The monovalent vaccines are ActHIB, Hibrix, and PedVaxHIB. The 2 HIB combination vaccines are Pentasol and Vaxilis. HIB vaccine contains a single antigen, polyribosol ribitol, or PRP. PRP is a polysaccharide from the capsule surrounding the Hib bacteria. The primary difference between the three Hib vaccine is the protein to which the PRP is conjugated. Let me explain this to make it a little bit more clear. By itself, PRP does not produce a lasting immune response. But when conjugated with a carrier protein, either tetanus toxoid carrier protein or a meningococcal outer membrane protein, it provides a strong T cell dependent antibody response that can be boosted by additional doses, providing long lasting immunity. Some parents and caregivers are interested in vaccine ingredients. For certain vaccines, a short ingredient list can be reassuring. When it comes to the Hib vaccine, ActHib contains 10 micrograms of Haemophilus influenzae type B PRP antigen conjugated to tetanus toxoid and also contains 8.5% sucrose. Hiborex contains 10 micrograms of PRP antigen conjugated to tetanus toxoid. It also contains small amounts of lactose and residual formaldehyde. Pedvaxib contains 7.5 micrograms of PRP antigen conjugated to Neisseria meningitidis outer membrane protein and 225 micrograms aluminum as adjuvant. None of the Hib vaccine contains antibiotics, thimerosal, or preservatives. Hib vaccines produce a strong immune response, with 95% of those who complete the primary series demonstrating protective levels of antibodies. Clinically, Hib vaccines are 95 to 100% effective in preventing invasive Hib infections. Hib vaccines also provide strong protection for those most at risk of invasive disease. That includes those with sickle cell disease, leukemia, persons with HIV infection, or those who have had a splenectomy. Strong immune responses are maintained when given in combination with other vaccines. In addition to being remarkably effective, Hib vaccines have excellent safety record. Adverse reactions from Hib vaccines are uncommon. The frequency of reported local reactions, including mild swelling, redness, or pain at the injection site, was 5 to 30%. The most common systemic reactions reported from the vaccine adverse events reporting system, or VAERS, were fever, 31%, crying, 11%, injection site erythema, 11%, irritability, 10%, and rash, 9%. Most of these reactions are mild and will resolve on their own within a day or two and do not require medical attention. When it comes to vaccine recommendations, to ensure vaccines are safe and effective, vaccine recommendations are continuously updated on new information from disease surveillance systems like the National Notifiable Disease Surveillance System and the Active Bacterial Core Surveillance System, the Vaccines Adverse Events Reporting System, or VAERS, as well as the Food and Drug Administration, vaccine manufacturers, and independent researchers. The CDC Advisory Committee on Immunization Practices, or ACIP, is the body that reviews this data and determines the recommendations published in the CDC immunization schedule. ACIP is a group of clinicians, researchers, public health experts, and at least one unaffiliated community member that meet at least 3 times per year. ACIP meetings are open to the public to increase transparency and public trust regarding vaccine recommendations. When it comes to Hib, the CDC immunization schedule recommends use of ActHib, Hiborex, Pentacel, or Vaxilis. Each are given in a 4-dose series, 3 doses in the primary series at age 2, 4, and 6 months, followed by a booster dose at age 12 to 15 months. Vaxilis is not recommended for use as a booster dose. A different Hib-containing vaccine should be used for the booster dose. Pedvaxib is given in a 3-dose series with 2 doses at age 2 and 4 months, followed by a booster dose at age 12 to 15 months. For American Indian and Alaska Native infants, Pedvaxib and Vaxilis, which also contains Pedvaxib, are preferred over other Hib vaccines for the primary series. These are the vaccines that use the PRP conjugated to the Neisseria meningitidis outer membrane protein formulation, which was mentioned previously. These vaccines provide a higher antibody response after the first dose, providing stronger early protection for American Indian and Alaska Native infants whose susceptibility to infection begins earlier in life. As with any vaccine or medications, those who have a history of severe allergic reaction to a vaccine component or following a prior dose of the vaccine should not receive the vaccine. Hib vaccines should not be given to children younger than 6 weeks of age, as it is ineffective and could interfere with future Hib vaccine immune responses. Moderate or severe acute illness with or without fever is the only precaution for the use of Hib vaccines. You may have thought during this section on vaccine recommendations, wow, this is getting a little complicated. If only there was an app for that. Well, there is. The CDC Vaccine Schedule app is a great resource for vaccine recommendations. It is available for download for free for both iPhone and Android phones. The app is continuously updated with the latest immunization schedules for children and adults. It also includes catch-up schedules for people who may be under-immunized, as well as the most recent information on vaccine precautions and contraindications. To recap thus far, we have discussed the Hib disease and vaccine, as well as current vaccine recommendations. Now we will discuss strategies for talking with parents and caregivers about Hib vaccines and vaccines in general. Notably, suggested approaches and talking points are based on research conducted by Native Boost. In 2024, Native Boost conducted 11 focus groups to gather the thoughts of tribal community members and healthcare providers and clinic staff in the Pacific Northwest. In the end, we spoke to over 58 providers representing 12 tribal and 2 urban clinics and over 44 tribal community members from across the region. Through speaking with community members, we learned that they want to learn basics about what the disease is and why vaccines are important via face-to-face conversation with trusted medical providers. That's when educating parents and caregivers about Hib it is important to take time to discuss what Hib infection is, as well as the potential consequences of not vaccinating against it. Something to keep in mind when speaking with Native people is that it is vital to use clear and concise language and to avoid using medical or scientific jargon. During talking circles, many parents and caregivers expressed that they did not understand or relate to medical or scientific terminology. To avoid making their providers feel like they were being challenged, parents and caregivers commonly said they avoided asking questions about concepts or words that they did not understand. So as a provider working with Native people, when you use medical or scientific jargon, you are missing an opportunity to effectively communicate valuable information to your patients. When it comes to speaking with your patients about Hib infections and the potential consequences of not vaccinating against it, consider saying something like this. Hib is an infection that spreads easily. It can cause damage to our brain and nerves. When this happens, people may not be able to move parts of their body. Some even need help caring for themselves for the rest of their lives. Some people who are infected with Hib don't show any warning signs, but they can still pass it on to others. Thankfully, there are vaccines that can help protect everyone starting at 2 months. Then consider letting parents and caregivers know just how effective Hib vaccines are by saying something like, I let my patients know that Hib shots are effective. Most children who are fully vaccinated will be up to 99% protected. And if your child gets vaccinated and then happens to get sick, which is very unlikely, their illness will probably be mild. Encourage starting the vaccine series on time to provide the maximum protection during the first year of life, especially for American Indian and Alaska Native infants who tend to be exposed earlier in life. Based on Native Boost research, one of the topics Native parents and caregivers were frequently interested in was vaccine safety, particularly as it relates to Native people. To address parents and caregivers' concerns about Hib vaccine safety, make sure to let them know that since Hib vaccines can result in serious health illness, like the inability to move and death, we have been regularly vaccinating kids against it in the U.S. since 1988. Since Hib vaccines were approved, millions of Americans have safely received the vaccine, including American Indian and Alaskan Natives. Make sure to remind your patient that serious reactions to vaccines are uncommon by saying something like, if you feel hesitant about vaccinating, keep in mind serious reactions to vaccines, like the Hib vaccine, are extremely rare. You're more likely to get hit by lightning than have a severe allergic reaction to any shot. Based on Native Boost research, it's important to normalize mild vaccine side effects. Make sure to emphasize that after receiving the Hib vaccine, like any vaccine, children may experience mild side effects. Consider saying something like, when it comes to the Hib vaccine, common side effects may include fever or pain, redness or swelling where they got the shot. Mild side effects are a good sign that your child's body is preparing to fight Hib. Within our bodies, each of us has warrior cells, also called antibodies, that stand guard and attack disease. Vaccines like the Hib vaccine help our warrior cells see and fight disease. For example, when we get the Hib shot, the ingredients in the shot tell our warrior cells how to recognize and fight against Hib. Sometimes when our warrior cells are preparing to be able to fight, they cause mild side effects. These side effects are not a sign of illness. They're a sign your child's body is getting prepared to fight, if needed, against Hib in the future. Most mild side effects usually go away within a few days. If anything seems unusual or you are unsure, call the clinic. We can help. To summarize thus far, we have discussed the importance of educating parents and caregivers about the basics of HIV, including what HIV infection is, as well as the potential consequences of not vaccinating against it. Based on our research, we emphasize the need to use clear and concise language void of medical and scientific jargon. We also offered language that can be used when discussing HIV vaccine effectiveness and safety, and the need to normalize the experience of mild vaccine side effects. Now we will discuss strategies for sharing culturally resonant messages with parents and caregivers that center a Native perspective. Something tribal community members said would encourage them to get their kids vaccinated. When asked about effective messaging around vaccination, they commonly expressed the desire for providers to emphasize the benefits of vaccination from both an individual and community perspective. To do so, consider reminding patients that vaccination protects their child and others in the community. Also, remind parents and caregivers their responsibility to care for one another and for generations yet to come. Finally, make sure you present information about vaccines in a way that honors parents and caregivers' autonomy and individual sovereignty. This includes providing information about vaccines in a non-judgmental, empathetic way that affirms parents and caregivers' experiences while sharing accurate information. As medical providers, it's critical to listen to patients' concerns, take time to share basic information about vaccines, answer questions, address myths, and accept that parents and caregivers have the power to determine the right choice for their child and their family. And to enhance your knowledge about HIV and other vaccine preventable diseases, there are a few resources I'd like to share. First is the Epidemiology and Prevention of Vaccine Preventable Diseases, also known as the CDC's Pink Book. This comprehensive manual provides detailed information about vaccine preventable diseases and all vaccines on the CDC immunization schedule. The most recent edition was published in 2021. Since then, however, there have been changes made to the schedule. To ensure you have the most up-to-date information, make sure you check out the CDC 2025 Child Immunization Schedule. The CDC 2025 Child Immunization Schedule can be found on the CDC's website or accessed on the CDC Vaccine Schedules app. Finally, if you would like to access culturally resonant patient education materials offered by Native Boost, visit www.nativehealthresources.com. Also, check out www.indiancountryecho.org/boost for additional trainings for medical providers working at Indian Health Service, tribally run, and urban Indian healthcare facilities. Thank you for watching this presentation. Together, we can increase the number of Native kids who are protected against HIV and other childhood illnesses.